Vertigo is that feeling that your head is spinning. There can be multiple causes which will be discussed in this video. To break down the causes of vertigo, it is easier to look at it from different parts that can be affected. So starting in the ear at the vestibular system, which is responsible for balance, then the cerebellum, and lastly the systemic causes. Right, so let's look at the vestibular system. Benign paroxysmal positional vertigo, also known as BPPV, which is where there are deposits in the semicircular canal, can cause vertigo. The vertigo is triggered by head movements and is not present when the head is kept still. Meniere's, which along with vertigo, patients will have tinnitus and hearing loss. Vestibular neuritis, which is an abrupt onset and usually follows a viral infection. It's important to know that the vertigo is present even when the head is still. Labyrinthitis, this has similar symptoms to vestibular neuritis, except that it has sensorineural hearing loss and tinnitus. And lastly, acoustic neuroma will also give vertigo together with deafness, tinnitus and cranial nerve signs. Let's move on to the cerebellum. If you have a posterior cerebrovascular accident, also known as a stroke, one of the cerebellar signs would be vertigo. Succumbing to severe trauma to the back of the head can also impact the cerebellum. Then, systemic causes. Starting at the top, the neurological causes. Syncope is when you faint. Pre-syncope is the period before you faint or pass out. In this time, the patient could experience vertigo. Your vestibular migraine could also be the cause. Then moving on to the cardiovascular system. Arrhythmia can result in decreased cerebral perfusion and cause vertigo. They can also cause the formation of a clot in the heart which detaches and causes a pulmonary embolism. Orthostatic hypotension is also a cause of vertigo. Hypoglycemia due to multiple factors can also cause vertigo. Lastly, drugs and alcohol use can cause vertigo. Medical drugs that have the side effect of vertigo include anticonvulsants and aminoglycosides. These causes can be difficult to put together in a clinical picture. So let's break it down in a way that it can be more clinically appropriate. So firstly, find out if the vertigo is episodic or acute. Then find out what triggers it. Triggers include head movements, as in BPPV, standing up too quickly with orthostatic hypotension, and lastly, a serious problem that you should be careful of is central paroxysmal positional vertigo, which is also triggered by head movements, but you will find nystagmus on examination. This can be caused by a stroke or a posterior fossa tumor. It is possible that the episodes are not triggered as well, in which case it could be Meniere's, vestibular migraine, or drop attacks. More serious causes include a stroke, arrhythmias, pulmonary embolism, and hypoglycemia. These should be seen to immediately. For acute causes, these will be due to either exposure to something, so trauma, drugs, or toxins, or it can simply be spontaneous, as in vestibular neuritis, which can occur any time within a week of having a viral infection, and lastly, a posterior stroke. I hope this breaks it down nicely for you to create a clinical picture in your mind. If you find this video helpful, then click the like button, subscribe to the channel for more and leave your comments below. Thank you.